Hello guys, I'm Dr. Soumya Gupta from UCMS New Delhi. I got a rank of AIR 37 in NICT May 2023 and AIR 233 in NEET PG 2023. This video focuses on the most talked about topic nowadays, which is the next examination. I could not upload a video last week because I was not well. My throat is still bad, so I'm sorry for the poor audio quality. This video does not focus on the rules and regulations and the guidelines of the next, as it is available everywhere on the internet. This video mainly focuses on the student's perspective into next towards next examination, which means if I was in your shoes, how would I have tried to react to it. And I'm here to help you and guide you on the mindset, approach and strategy which can be followed based on whatever information we have regarding the exam right now. So we'll be starting with updates. I will be discussing updates, the mindset and the strategy. And strategy and mindset both are equally important to be done for a desirable rank. So we'll first be starting with the updates. 2019 batch is the first batch to appear for next. Our interns and post interns will mostly appear for NEET PG because in the interim period there will be an overlap between the two exams. November INI-CET will likely occur, so it is a good chance to prepare for it and crack it for interns and post interns. We are not very sure about the timeline of the next exam, with whether it will, even in the gazette that appeared today, it is not clear whether the exam will happen in November 2023 or May 2024. But based on whatever the timeline is, I will be giving a detailed strategy in a separate video when there is some clarity regarding the timeline of the exam. Okay guys, so basically the coming to the pattern of the exam, medicine and allied subjects include derma and psyche, comprises of 120 questions. Surgery and allied subjects, which is anesthesia, radio and ortho, again comprises of 120 questions. OBG comprises of 120 questions. Peds, ENT and Ophthal comprises of 60 questions each. So you can see through the pattern that will require ample MCQ practice and conceptual understanding, which is anyways the foundation to clear any exam, right? So it is not really that different as it is appearing to us, right? Problem solving and analytical questions will comprise 65% of the paper, comprehension type will comprise 25% and recall type will comprise 10% of the paper. Must know topics will comprise 60% of the paper, nice to know 30%, which means must to know plus nice to know topics comprise 90% of the paper, and main know topics comprise 10% of the paper, only 10%. चलो पहले माइंडसेट की बात कर लेते हैं कि व्हाट इज द राइट वे टू अप्रोच दिस कंफ्यूजन. फर्स्ट ऑफ ऑल, इट्स वेरी ओके टू फील anxious and frustrated at this point of time regarding the lack of clarity and the sudden change in the pattern of examination. It's okay, it's very human, but at the same time you have to realize that whatever is the pattern of the examination, there are two things which are always going to factually hold true. What are those two things? The first thing is that the confusion is for each student and the ranks are relative. So the students who will try to keep calm in the system, in the middle of the system, and keep their efforts aligned and will work towards it, will get a head start, right? By saying this, I'm not disregarding the anxiety that you are having. I'm just saying that life gets better when you focus on the things which you can control, because anyways you cannot control the things which are not under your control. So we'll mainly focus on what we can do towards this changed pattern of examination. What is the second thing which holds true? Your conceptual understanding of the subjects will always come handy and will always prove to be very beneficial regardless of the pattern of the examination. Okay. You also have to train your mind to not get distracted too much. It's okay to be frustrated at times, but you have to utilize this time to get a head start when everyone out there is focused on focused on the clarity and the integrities of next examination. You should keep putting your efforts each day and get a head start. It will prove to be very beneficial for your for the exam to come. Do not consider this exam as a make or break. By this, I do not mean that you don't have to put your entire efforts and give your best attempt towards the next exam whenever it is scheduled, whether in November or May. By this, I mean even in this exam, you will have multiple attempts. Don't consider it like it is the end of the world. You just have to put your entire efforts and try to give the best exam to the best of your potential. I know it's very hard to be optimistic at this point of time, but together we will try to see bits of optimism in this changed pattern also. Maybe exam twice a year will prove to be a blessing in disguise. Okay, now coming to strategy. This strategy is for and interns and post interns will continue to prepare the same way as they were preparing, because their pattern of examination is going to be exactly the same as it has been for the previous years. They are going to give NEET PG 2024 likely. Right. Coming to strategy, this strategy is mainly for final year students, and this is not a day-to-day strategy or a tailor-made strategy. This is just an overview of the strategy, because we are not clear about the timelines of the exam, and based on whether the exam occurs in November 2023 or May 2024, the strategies would differ. But what is the worst case scenario for us? That the exam occurs in November 2023. So I will try to give an overview of the strategy for those who are starting now, right? And how you can prepare yourself to some extent before the examination. So what you can do is, you have to focus mainly on final prof and third prof subjects. Also, please give the mock test even if you are at any stage of preparation, even if you have not completed your notes, because you get acquainted with the pattern of questions and it enters your subconscious mind. It will help you when you will prepare for the exam later. Also, first get done with your first reading and get acquainted with the subjects. I am assuming since you are a final student, you are familiar with ENT and OPTA. I am not saying that you are pro at it. I am just saying that you are familiar with it, right? Get yourself familiar with the final prof subjects too. You can go through revision videos for radio, ortho and peds, and main videos for the rest of the subjects. I would personally advise not doing marrow for medicine, because it is a little too much to be completed now. You can go through the notes of DAMS for medicine, because they are pretty concise and crisp. Keep on practicing MCQs side by side, and remember PYQs are important even for this exam, because they will mostly cover your must to know, which is 60% of the paper, and nice to know topic, which is 30% of the paper, which together makes 90% of the paper. Okay, so basically I am giving an overview of the strategy which you can follow if you are starting now. First, get completed with your medicine, surgery, OBG in 2 to 2.5 months. You can allot 20-25 days per subject and try to get a hang of it. Peds, ortho, derma, psyche through revision videos should be completed through revision videos in another 1.5 months. Then start with making custom modules of 50 to 100 questions starting with ENT, and try doing retrograde revision through them. I have highlighted in like a lot of my previous videos the importance of retrograde revision and how it serves as a key tool in consolidating your memory. You can go through my previous videos if you have not watched them to understand the basic concept of retrograde revision and how to do it effectively. So basically, after your first read of the final year subjects, allot 20 days for MCQ practice. How do you go on doing it? This is how the schedule will look. You can see on your screen. Basically, you will make a custom module. Again, this custom module is a provision on Marrow. You can put hashtags of hashtag NEET, hashtag INI-CET and hashtag clinical. NEET PYQs are anyways important. Why hashtag INI-CET PYQs? Because AIIMS is the one making the next pattern of examination paper for next exam. And why clinical? Because there are a lot of comprehension based questions which are likely to be asked in this exam, right? So these hashtags will cover your different types of questions which are going to be asked. So your first 2 days will be allotted to ENT. You have to attempt 50 questions. Then you have to note down topics which are volatile and important, which are getting repeated each time, and you have to note them. You have to note as a 5 to 10 topics each day. You have to allot 2 hours at the end of the day to go through the and you have to go through those topics through your notes. Those topics will be consolidated in your memory like a rock. It will be like a very solid memory. Then third and fourth day will be similarly with the similar hashtags will be allotted to OFTA 50 MCQs and retrograde revision. Fifth and sixth day to PETS. Seventh, eighth, ninth and 10th day will be allotted to Derma, Ortho, Psyche and Radio. These are short subjects, so one day for them is enough for attempting 50 questions and doing retrograde revision. Then 3 days for OBG, and OBG may have to attempt 100 MCQs and go through retrograde revision. 3 days फॉर मेडिसिन में 200 MCQ अटेम्प्ट करने की कोशिश करो. सो बेसिकली 2 पार्ट्स में डिवाइड कर सकते हो. GI, कार्डियो और SP एसिड बेस के 100 क्वेश्चंस कर लिए, और एंडो, न्यूरो, रिमाट एंड रिमेनिंग के 100 क्वेश्चंस कर लिए, एंड रेट्रोग्रेड रिविजन ईच डे. देन 17, 18, 19 डे को यू कैन डू सर्जरी एंड रेट्रोग्रेड रिविजन. डे 20 पे यू डू द लेफ्ट ओवर जो भी इसमें रह गए. Keep on clicking the photos of volatile parts here and there whenever you find something which is very difficult to remember and you are seeing that it is important and is getting repeated everywhere. You have to click a photo and keep it in your phone to be revised towards the end of your preparation. After these 20 days of MCQ practice, your PYQ practice and your comprehension based questions practice, you have to keep another round of revision for these 6 subjects which are asked in next exam. Lastly, consolidate your reading by you can go through DVT or BTR of third prof and final prof subjects, and you have to complement them with your volatile list which are in your phone for your final lap of preparation. Okay, so guys, this is all for like the video, all for this video, because you're not very clear about the timeline of the examination. Once the timeline of the examination comes, I will be making another video on a day-to-day basis and a more detailed basis of how you can go on attempting this examination and how you can go about preparing this examination, preparing for this new pattern of examination. Thank you guys, and if you like the video, please subscribe.